Welcome everybody. My name is Anna Burhouse and I'm the Director of Quality Development at Northumbria Healthcare, and I'm delighted that you've joined this special Q Exchange webinar. So today we'll be sharing the overarching feedback from the Q Exchange panels and discussing one of the main themes that emerged around taking a system-wide approach and involving all stakeholders. And we'll be thinking together with our panel about an example of building improvement capability across boundaries delivered for us for the lovely Sussex Partnership NHS Foundation Trust. That's great. We're planning to leave some time after the presentations for some group discussion, and we're genuinely really interested in your experience of the Q Exchange to date, what you've learned through this process, and kind of what your hopes are for the future too. So we hope that you'll have lots of inspiring thoughts about how to help people keep going with their ideas. But let's, after welcoming you, let's also introduce you to the panel today. So we have Steve. Steve, would you like to introduce yourself?
Steve is literally, he thought he had time to run to the loo. He'll be back in 10 seconds. I don't know why he suddenly put off that time.
So maybe, Jonathan, you could introduce you and Steve. How about that?
I'll spend a bit of time to say that picture was taken when I did a marathon, but several years ago. So I don't always look like that.
Great. What's your role, Jonathan?
Well, look, I've done well. I've busked Steve. We're doing the introductions.
Oh, lovely. Hi.
Hi, Steve.
Hello. Yeah, I'm the lead for our quality improvement programme at Sussex Partnership. I'm a nurse by background. Yeah, and I've got certainly a passion for compassionate leadership, psychological safety and all them kind of things. So yeah, it's really nice to be here.
Right. And Jonathan, what's your role at Sussex Partnership?
At the moment, I'm just looking at Steve's photo. He looks very surprised in it. Anyway, sorry, I can't help myself. So I'm also a mental health nurse. I've worked at the Sussex Partnership since I qualified in '96, and since January I've been working full-time with Steve as a senior nurse, quality improvement and development.
Brilliant, thank you both. And we also have Zoe with us. Zoe, do you like to introduce yourself?
Yes, hi everyone. So my name is Zoe. I work at the Health Foundation, specifically on the Q programme, and I am the project lead for Q Exchange.
Fantastic, brilliant. So we've also got Rosie here in the background. Rosie will wave as well. Rosie also works at the Health Foundation, is supporting the team today. So really lovely to have you all with us. So just a quick bit of housekeeping. So during this webinar, feel very free to use the chat function to the side to ask any questions or kind of share your thoughts with each other. When the presenters have finished, you can use the hand button. There's a little hand button at the bottom to let us know that you'd like to ask a question or share your experience or your reflections. So we can then unmute you. As long as your audio is working on your computer, we'll be able to hear you live, which would be lovely. So do feel free to kind of join in that way, and do feel free to kind of really share your experiences to date. So let's have a little look then. What are our Q Exchange statistics for 2019? It's incredible really that our community generated 117 ideas. And 30 of those ideas have been shortlisted for through 10 Q panels. Now, 18 of those projects are shortlisted in the Building Improvement Capability Across Boundaries theme, of which 12 will go through next week on Wednesday. And 12 are also shortlisted from the Understanding Alternatives to Traditional Models of Outpatients theme, of which 8 will go through. So the voting is in, it's done, and it'll be the first time ever that we'll have a kind of a live reveal of the results on Wednesday at the annual event. So I don't know about everyone else, but I'm really excited to see what happens with that. I think it's fantastic. So for the first time ever as well, every Q Exchange idea that was submitted was assessed by panels of fellow Qs. I think that's a brilliant way of doing it because it allowed people to kind of really get involved in the process. And I'm very grateful to these fellow Qs because they produced a raft of really helpful feedback about the bids. And there were 7 overarching lessons about how the bids could have been improved. And they're up here for you. And what I'm going to do now is briefly run you through each of these 7 topics to give you a sense of what the Q panel said about each one. So the first feedback theme concerned the fact that it was really important to make a very strong case for change, and that the panels really wanted to have a very strong sense of what the aim of the project was and also what your quality improvement methods were. They highlighted that the most successful bids really built a compelling case for change. They explained why the intervention was needed. They were clear about both the improvement aim and also the methods that they would use to implement the idea. And on reflection, I think if you look at some of the strongest bids, you can see that they really articulated some of the Institute of Medicine's 6 aims for improvement. And they showed really kind of what they were trying to achieve under those domains. They also explained what type of quality improvement methodology they were going to kind of try and use. And they were also clear as well about whether it was a quality improvement approach that they were proposing or a research approach, and made a very kind of clear distinction between the 2. For some, that was a bit of a muddle and it could have been a lot clearer. And the panels felt that in the future, it would be great to be able to have a clear articulation of that. So then the next theme in terms of the feedback was about the need for specific, measurable, achievable and realistic and timely goals. Applications for Q Exchange are judged very closely for their feasibility within the available resources. And the Q panels felt that some of the bids would have been enhanced by using a very clear approach to it so that the reviewer could understand the boundaries and feasibility of each of the projects. Panels also felt that the budget should be looked at carefully to ensure that the project would be affordable. Q Exchange reviewers really wanted to see some assurance in the detail of the bid that the idea would be deliverable and had a really good chance of success. So then the third theme was about the measurement of impact and outcomes. The reviewers were looking for a clear measurement strategy in the bid. And whilst there isn't a direct ask in the application process for process outcome or balancing measures, they're clearly seen by our community to be a cornerstone of improvement as they help to establish whether an improvement has happened or not. So reviewers felt that building in relevant measures at the application stage would have enhanced bids, and that taking a structured approach to measurement and data collection would increase the likelihood of success and sustainability. I actually think it's lovely that we're getting us really mature around this and really thinking about measurement. It's a great sign to see. And then the fourth theme was about just how important it is to involve and engage patients, carers, staff and the public in improvement ideas. And across the 117 ideas, this was an area that saw a really wide variation of approach, from those ideas that didn't mention engagement and involvement at all, to those that said they would do it but didn't explain how, through to really sophisticated ideas for engagement and involvement that made up the majority of the bid. Bids were definitely stronger when the approach was inclusive, showed that people's lived experience was valued, and were clear about how involvement or engagement would be organised and measured. Some of the bids outlined the use of established QI methodologies, like experience-based co-design, or the use of techniques like appreciative inquiry, whereas others came up with methods like using surveys, focus groups, crowdsourcing on Twitter, or making use of the Q Network co-production special interest group to tap into ideas and to expertise. And a separate webinar on this subject is available on the Q website for those of you that would like to hear more about that. The fifth theme was about dissemination and engagement with the Q community. Unlike most funding awards, the Q Exchange aims to be collaborative rather than competitive. And bids were judged to be stronger if they described how the bid team would actively engage with other Qs, make connections, to share experiences, and to also to draw upon the expertise of Q to enhance the project. The Q community is also a natural vehicle for dissemination of learning at the end of the project, and also a potential way of scaling up the idea across different geographical or subject matter areas. So bids that had a clear plan to secure or share their work at the end with the Q community were definitely seen as stronger by Q panels. This kind of connects really with the next theme, which was about sustainability beyond the Q exchange. And whilst there's no expectation that any of the bids, shortlisted or otherwise, will continue beyond the end of the Q exchange programme, we know from last year that many bids have continued to thrive, and that thinking about what it might take to be sustainable is helpful right from the start. In our discussion after the presentation today, we'll have an opportunity to think together about ideas that you might have about how to keep your Q exchange idea going, and how we might help each other with this process through the Q community. And last but not least, the final theme emerged that was about taking a system-wide approach and involving all key stakeholders. Some of the Q panel reviewers felt that the bids could have been stronger if they'd explained how the work would impact on the wider system, either at a local, regional or national level. Many bids only describe potential gains for their own organisation or staff, and forgot to articulate a comprehensive engagement plan with key stakeholders like neighbouring trusts, CCGs, primary and social care, third sector or patient groups. For example, some ideas to improve outpatients only outlined hospital-based changes and didn't describe how they'd engage with stakeholders from primary, community or social care. Whereas some of the building improvement capability across boundaries themed bids would have been enhanced if more emphasis had been placed on a partnership approach to design or delivery, or if they'd described how the results would have been shared with local stakeholders. So, one of the great things about being in the Q community is that we can all draw on each other's knowledge and support to help us. So please do share your ideas and your experience of being involved in Q Exchange via the chat button, and share with your ideas with us about what you think people might benefit from in terms of taking this work forward. So in the spirit of all teach and all learn, I'm delighted that we have Steve and Jonathan here with us today, and they're going to share their experience of building improvement capability across boundaries through the great work that Sussex Partnership NHS Foundation Trust has been doing over the last few years. Sussex, if you don't know it, is a really huge geographical area to cover. It's got multiple system boundaries involved in it, and Steve and Jonathan have been working really hard to create a thoughtful and inclusive approach to improvement. Welcome both. I'm going to hand over to you now.
Yes, thank you. So let me. Okay, so we're gonna go over really what we've currently kind of achieved with our program at Sussex Partnership. So it's really about how we've been able to work at that kind of systems organizational level, but also then how we're working with projects, and also the kind of learning that we've gone through is very similar, what level you work on, whether it's organizational level, systems wide level, or clinical teams at a local level. A lot of the learning and the difficulties with progress and the barriers that you face are pretty much same. They're just in a different kind of context. So with working with context, we're going to quickly go over who we are at Sussex Partnership. And then we're going to look at this kind of three-phased approach. We've looked at how we kind of embed quality improvement organisationally, where we're currently kind of at. And then we're going to go into a little bit more depth around each individual phase, which is kind of discovery. Then we've got programme implementation, and then we've got continuous improvement. And then we're going to go into some practical suggestions from Jonathan and myself around our experience and learning. So if we go back to who we are, this is us really on Google Maps. So as Anna's just said, we are quite a big organisation geographically. I think it's one of the biggest in the trust. But in regards to service provision, we are very similar to that of say East London in regards to our staffing. We've got 5,000 staff, and pretty much into our population, although the likes of East London has a more concentrated population due to London, the density. But that gives us a different challenge because we need to get out geographically across a large area. But we are a mental health services, and we also have CAMS, learning disability. We also have a forensic service as well. But maybe, is there anything more we need to say about who we are?
I think it's worth just reiterating that that Sussex is a big area, but we don't have good roads and that, so it's to get from one end to the other takes quite a long time. Did you mention CAMS in Hampshire as well?
Right, yeah, all the way up there, Hampshire.
So yeah, no, nothing more to add than that.
Yeah. So I think when we're looking at this kind of three-phased approach, certainly the first kind of phase we realised took a year, and that kind of was more of a self-assessment, and then we're looking at being able to implement a programme, and this was, we loosely gauged this into around 6 years for that being able to transition from that period into what is kind of continuous improvement, and now we embrace this kind of quality improvement, quality assurance, quality control, and then quality planning in equal parts and in a synergy. So we're become a learning organisation. But that was in essence what was our thinking and our kind of approach when we started thinking about a programme. And it gives us some kind of time frames, realistic time frames that we need to kind of work with. So we're currently here, so we've put this into some dates. So we started April 2017, that discovery phase lasted till April 2018, and we're now in kind of November 2019. So you can see kind of where we're at, and also where we plan to be around April 2024. So these are our kind of aims, and the time frames we're kind of attempting to look at. But let's go into this discovery phase a little bit more. So we're kind of looking in this area at the moment. This discovery phase was certainly a challenge and not necessarily a luxury. And we've got something interesting happens here, is that we've got the business case in February 2016. So there was actually quite a lot of work took place before we started introducing the programme. Now, my position here was the QI programme lead. I was appointed in April 2017. But there was a realisation as Sussex Partnership came together in about 2013, 2014, it came together as a partnership because it was individual providers in Brighton and Hove, East Sussex and West Sussex. And actually, there was actually a difficult time, kind of managing out of the crisis for Sussex Partnership, because within a foundation trust, that them early years, it took a very business kind of framework and a business model. And how it was looking at financially how it was working. But there were some really difficult times, certainly around 2014, 2015, where there's some serious patient incidents and public incidents that were kind of headline news. And that took then a transformation in what was looked at through listening into action as an organisation. And so when I came into post, there was certainly an understanding that there was this discovery phase that needed to be a self-assessment. Now, if you take the Institute of Health Improvement or any kind of other organisation like that, they will come in and start looking at the kind of organisation's adoptive capability and do that kind of intervention and that kind of assessment to look at what's required in regards to the nature of that strategical partnering. We explored that certainly in that kind of self-assessment about where we were going to be with strategic partnering. Now, this kind of self-assessment was myself going around having a lot of conversations with key people. So it's very much shaking hands, getting to know people, engaging people, and realizing when you start having a conversation about how we're doing quality improvement and tools and methodology and the practices, there was a real misunderstanding of people, thinking that they're doing quality improvement when they're just doing improving quality through our normal kind of measures and approach. And that was quite difficult in the conversations that we were having. So this self-assessment was then kind of an intervention in itself. And through that kind of working, we realized that our best options are moving forward. And what the appetite with the organisation was not to look at a big strategic partner, but was to look at the communities of practice, our academic health science network, and how that took us really to embracing the Q community and what that offers and what that kind of developed, certainly from its initiation. I think it was around 2015, 2016. So we started really connecting as a Q community, and I was privileged to go on a number of visits to the Royal Academy of Engineers, which helped us with developing a kind of training program. Within this period as well, we also engaged in doing getting good with the CQC. And also developed, we capitalised on the online training package that the Academic Health Science Network developed through Yorkshire and Humber. And then the kind of last thing in this discovery phase was also about developing a core team. And this is where we actually integrated with clinical audits, which didn't give us any more resources. It actually gave us more more responsibility about how we're taking forward the clinical audits kind of yearly forward plan. So that was almost a difficulty in what we had to manage, but was actually also a blessing to us. It was an opportunity because we could do far more outreach work about changing the culture of clinical audit and what we're learning. And as I said before, this self-assessment, this discovery phase, was very much an intervention that actually created more of a social movement. So we were developing tension around what is quality improvement and how we work forward. So that takes us through our discovery phase, and then we were able to move more towards an implementation phase. So this implementation phase, as I said, we developed some kind of tension about what quality improvement is and what it isn't. And then we also held off with the training because we wanted to specifically design some in-house training that was actually based on what the organisation needed. And that created a real appetite. And so now what we're finding is we've trained over 500 staff. We've got a training session on today within a very short period of time. But the training's then developed for people to initiate and develop a project with support from us. We then started looking at aligning all the project work. So now we've got 90 projects, active projects registered, and we're currently aligning them to our kind of strategical way of working. So our clinical strategy, our national audits, our clinical audits, and the global digital exemplars. So we have a body of project work that we're actually aligning to these kind of big ticket service-wide kind of initiatives that's really helping us move our way forward. These were seen as barriers initially, but actually they've been really a place where we've been able to engage and develop the relationships within our organisation and the kind of management system that we're challenged with. Got anything to add on the implementation?
I think I'd just like to give a shout out to the 15-second, 30-minute initiative, which I'm sure many of you have come across. That really helped us to, we put QI projects with the infrastructure that Steve's talked about, but in a more of a kind of in very practical terms, 15 seconds, 30 minutes provides people with things that they can do now. So just wanted to give that a shout, really.
And this implementation phase, you know, we've had a strategy go to the board. We had a vision go to the board, but these papers, they aren't really the drivers of progress. They're a necessary, but they don't really drive us forward. What does drive us forward is the continuous engagement that we're having in different forums. So it's very much the people that we're working with. As soon as you do a strategy paper and it goes to the board, well, it's already old as soon as you put that to paper. So that's our real kind of learning. And then we've got some way forward to looking at continuous improvement. So again, this is where we're really looking at integrated system about how we're doing improvement. But this takes time to develop, to reach co-produced services being delivered. It does take time. And we're certainly learning a huge in this way forward. So I suppose our practical suggestions to help and support you.
So I'll just give a quick what I mean by these things. So what's really emerging is that you have to have psychological safety and compassionate leadership. It really is almost a precondition for a lot of the work that we're doing. And I see, I've got a coin here. I see increasing joy at work and reducing frustration as the same thing. You increase one, you decrease the other. They're directly linked. I felt also with bravery and humility, as Steve described in the discovery phase, you need to be brave because you need to have conversations. People often feel you're describing what they're doing as not important because it's not QI, when actually you're just trying to describe really what's going on. But so you need the bravery, but you also do need humility because you need to, often we've got things wrong, or we've got maybe we've had to go back and think about what a better approach might be. So again, I see them as sort of two sides of the coin, really. Obviously, there's a lot more to leadership than that, but just those two stood out for me. The other thing is, I've fallen into the trap of almost, is it called project-itis? Is that the word?
Yeah.
You know, we've got to have a QI project. How many projects have you got? How are they doing? You know, whereas what our training is around, it's about if you use the tools, if you use design thinking, if you engage your triangle of care, the projects come from that. You don't just get projects without those things. So that our training, the emphasis is even greater now on the fact that we want people to think and to practice. It's like sport, you know. It's not, people aren't going to be the finished article, you know. And the final thing, which links in with those, is we've had lots of requests to do lots of bits of work, and we always remain open. The door's always open. We have to engage people, even if it's not really, doesn't appear to be QI. But then that gives us a chance to really introduce what I've just said, really, about the tools and the thinking. So that's me in a nutshell, my tips.
I know we're kind of running over time, but my kind of practical tips is all improvement work starts with a self-assessment, and even organisationally there needs to be a self-assessment. And when you're going to do some project work and engaging people that you're dependent on in doing your work, and there needs to be going through that engagement and that self-assessment to really demonstrate compassionate leadership, but also develop psychological safety so you can do the improvement work and get over them kind of barriers. QI will always bring you back, because QI, the tools are you follow a process. And if you don't pay attention to a certain process, it will naturally bring you back because you will get a sticking point. And this is maybe something that you're learning through not getting the bid through the Q community. You've maybe missed a step in the process of where you need to be, and going back and doing that engagement and bottoming out what are you really aiming for. And then also creative ways. Well, we often think creativity is having the new idea to solve something. Create opportunities when you see barriers. And so you might say this barrier now that you've not achieved the bid, but it's actually an opportunity for growth and development. And that's what I've learned continuously. Thank you very much. I'm sorry we've run over to your time. We could talk about this endlessly.
Brilliant. Thank you so much, Jonathan, Steve. That was really interesting. And yeah, I think I could listen to you for hours.
Really.
And
We loved it.
really, really good. Great. And thank you, Anna, as well, for presenting some of the collating all that feedback and presenting some of the key findings from the projects this year. I'm going to open it to everyone to ask questions to the panel here. And I've actually got, there's two in the chat room. So I might just where is the chat room gone? Here we go. So
can we unmute Tim so he could ask his own questions?
Yeah,
Is that possible?
Tim, would you like to ask your question, or I can see what you've written in the chat room, but
I'm more than happy for you to ask it. Don't worry.
Okay, no problem.
Putting me under pressure there.
No worries. I just thought I'd give you the opportunity just in case. So we've got here a question, which is, what would you say your biggest challenge was during the discovery phase? So yeah, Steve and Jonathan.
Getting through it.
The biggest challenge was when you're in the kind of the kind of meetings, the forums, where a lot of the typical management kind of approach is being taken, and then people coming to you about asking, what can we do here? And then you kind of explain that we need to go through a process, and it's almost like, again, it comes back, we haven't got time for this, or there's too much urgency, and it's trying to really being able to be sticking really to managing upwards and being able to have disagreement but keep the relationship. And there's something about how you build tension, there's creative tension, and this is where you get to developing forward. But the thing is, you don't want that to overspill into emotional tension. So you still have to remain friends by what I've been really challenging. And if you don't have the psychological safety in that forum, that is really difficult. But you have to lead, and you have to keep going, and knowing that even that conversation, even if it's difficult, you are doing some improvement work because you're having that dialogue, you're developing, you're working. So it's hard sometimes to realize the feedback and the impact that you're having, but rest assured you are having an impact. And always go where the energy is. Sometimes there's positive energy where it's really easy and really working and excellent. Sometimes it's negative and it's difficult, it's sticky, it's horrible, but they're both are necessary, really.
It's really important, isn't it, Steve, to almost like create that space for discovery? Because I think in the NHS we often have a culture of just get in and fix and do, and I think it's really important. And actually, if you look at design in other industries, that discovery phase is one of the most valued phases, isn't it? Because it allows people to really get to know the system that they want to improve. So, but I think operationally it can be really hard to almost like defend the fact that you want some kind of discovery time rather than just leap to action. So I think you've done a great job in doing that, and it's great to hear that you had senior support to do that as well.
Yeah, that's been
really important.
Yeah, chief executive, chief medical officer, chief nurse has all been really integral. Yeah.
Yeah, absolutely, because it takes that senior leadership to signal that it's okay to take time to find the right solution for your local system, isn't it? Rather than just maybe importing something from somewhere else.
Yeah.
That's really interesting. And I guess there's another question from Tim as well, which is when you're going through your process for reviewing requests for improvement support, what was that actual process, and how do you decide the problems or issues or project you're asked to support suits the improvement methodology that you've come up with?
Yeah, that's a really good question. So I suppose what we've done is we've really developed a process where we're thinking about what it is we're trying to improve. So when people come in and ask us different things, we're testing out what the kind of relationship is that we've kind of got. Are we engaged in a coaching relationship? Because if we're not, then we need to kind of develop that. So when the ask comes in, can you do this? Can you maybe sort out some performance issues? It's really difficult. So I mean, one of the tools is the 5 whys to root cause analysis is such an excellent tool. But another really good tool is being able to kind of go in and start thinking about what it is that's been asked of you. What's the underlying kind of problem? Is this a symptom of an underlying problem? And just being able to think about who do we need to engage to understand this better. And this is where we use the nominal group technique to start asking a very powerful question, like what frustrates you, or how do we make, what stops every day being a good day? So if we're being pointed into a direction about a service wanting to improve a specific thing, we are confident that we need to go in there and work with that specific team about what it is they want to improve, or engage about what frustrates them, and being able to get ownership over the work and work out from there. So it's a very dynamic process, but we teach that in our Silvers trainings around the nominal group technique, and then asking what frustrates you. Go in there, remove the barriers, and they will actually discover what it is that your challenge was anyway, as a leader wanting to go there and possibly improve some kind of performance, some kind of issue around quality control, quality compliance kind of issue.
I think it's a really interesting question, Tim, because I think as well, nationally, as more and more NHS organisations and other organisations in social care take on a quality improvement approach, many start by encouraging 1,000 flowers blooming approach, where you go with the will and you just encourage improvement across your organisation. So we all know that intrinsic motivation is key to quality improvement, and that it's really important to encourage people to do that. But there's a really great paper by Professor Mary Dixon Woods as well that says, you know, if you carry on with that approach, you can actually inherently destabilize the system that you're trying to stabilize, because every single one of those 1,000 flowers then needs its own environment and its own, you know, if it was a flower, it would need food, it would need its own ecology, it would need its own watering system. And so I think what I'm noticing around the country is that there's a lot of NHS trusts that are really struggling with the issue of how to get their balance right between going with the will and letting the 1,000 flowers bloom. And then also, how do you align improvement effort in an organisation with your strategic approach as a trust? And how do you encourage improvement effort in some of the thorniest, trickiest, stickiest, messiest kind of issues that the trust has got to deal with? So I don't think anybody's, in my opinion, has completely got this right yet. I think we're all kind of experimenting with how to get the balance between the two things, you know, in a way that works for us. And I think the other thing is that there is very little kind of academic evidence at the moment of what to do. So that's why the work of Mary Dixon Woods at this institute is so important, because she's trying to improve the science of improvement and look at these issues in particular. So I think you've touched on a really interesting point to raise there, Tim, so thank you.
Cool. The next question is from Tony. So you referred to TQM, design thinking, IHI, microsystems coaching. Are you using a combination of all of these, or have you picked one model and stuck to it?
This is a great question. Have we stuck to one model? This is where my thinking around this is the kind of lean and IHI. They aren't the models. They've used something and developed a way of working, and they will go in and support organisations to this. And this is where I think we get a slight misconception about what improvement methodology are we working with, and are we applying this with rigor? We want, at Sussex Partnership, we're trying to develop the awareness of being able to use the right tools in the right way for the work that you're challenged with in that kind of context. So the 5 Whys to root cause analysis is a great tool, and part of underpins kind of lean thinking. Then you've got the model for improvement is very versatile to really getting on with project work, and for people to actually work with and develop. And these tools need to be applied with rigor. You can't deviate from them. As soon as you deviate from the tool, it will bring you back to what's underdeveloped. We've also looked at applying the double diamond design thinking tool, which has come from the Design Council and certainly been promoted by the Royal College of Engineers. But the first diamond is around design thinking, finding the problem. And first of all, you've got to find the problem before you get into project development and finding the solution. So that tool is really versatile and helps us to look at where a project is. So what we're trying to do is develop the competency to choose a tool, and then can we follow the process with rigor and with discipline? And that's where we'd like to get. So we have got this then ability to choose whatever tool we actually need, and then we're not dependent on a certain organisation. So we have to follow this well, and we need a QI mindset to be able to then choose the tools that we want to use and apply in the right way. Fundamentally, coaching on that.
I just add, and so this also, what my response here, it goes back for another some of the other questions as well, is what's really emerging is that we need to have psychological safety, the increasing joy at work, reducing frustration, and compassionate leadership, and they really are. They work so well with all of what we've described, and the experience we're having. And we've always had this experience, but it's becoming more and more important. We're asked to come in and do team days, and we're asked to engage with teams, because often the 1,000 flowers blooming, you're not always certain of the consistency of engagement, and as Steve said, using the tools to engage. It's not just engagement, it's using the tools. And our experience is when you get psychological safety with a team, you work with them and you ask them the right question, almost invariably they take you to the right place. And when I say the right place, I mean something that's important to that team, which actually matches. It's a complete match with the organisational stuff.
Absolutely. And I think it's really interesting again, and I think this is again a sign of a more kind of mature approach, is that there is still a lot of confusion, I think, about tools, methods and brands. Let's face it, most of these QI theories come from the same historical roots, and they have a lot in common. So I think it's really interesting, isn't it, about how, as an organisation, or today we're talking about maybe how a system would work. How do you define and how do you kind of describe to people what is the way that we do improvement around here? And I think, having that local context and having that local culture is really, really important. So for Northumbria, we describe it as the Northumbria way. And we might use, elements of experience-based co-design, for instance, to think about how we want to improve services. We definitely pay attention to clinical microsystems, and we're involved in the Sheffield Microsystem Coaching Academy. But that wouldn't stop us actually maybe using a very lean approach if we want to do something in pharmacy, because it's the right approach to take for that particular culture of that team, and also maybe for that particular outcome that we're trying to do. Now, I know it's controversial. I know some people think you should only stick with one approach and do that really well. For me, I think there's a difference with describing the way that we do it around here, and that everybody's aligned around your local approach. And everybody, when they come to work in the morning and they understand, that they are part of, Steve and Jonathan, you mentioned it being a social movement. I think improvement in organisations and across systems is often a social movement, and it's about how you kind of embrace different ideas and having thought diversity in order to tackle the issues that are prevalent and are needing to be so I don't know, I'd be interested I know, Tony, you've an amazing experience of doing work in atrial fibrillation and leading improvement at scale, so I'd be fascinated to hear what you make of that and what your experience is.
Yes. I think it's music to my ears, really. The fact that picking the right tool for the right job is more important than picking a mantra that you want everybody to sing to. But it's not perceived wisdom, is it? Locally, I've got trust leaders who think that it must be either IHI or Virginia Mason or and they're in the majority compared to the ones who have gone, well, I've tried Virginia Mason and it didn't quite do the job for me. I've added in the microsystems coaching or so I think it's an interesting challenge. But the success that we've had is when we mixed the tools.
Absolutely. And don't you think it'd be wonderful if there was a bit more research into this area, you know, and we could make some informed kind of consumer choices around that? I mean, that's certainly what I would like to see going forward. So, yeah.
I agree, research is great, but more opportunities like this where people in queue can exchange these kind of ideas is just powerful to me.
Yeah, totally agree.
I'm really struck by this sort of everyone, you know, the embracing the different methodologies, you know, and the challenge of that you're saying, Tony, about having people who are really favouring one method. And I think that, you know, the reality is not one size doesn't fit all. But we also talk about how do we, you know, translate learning and share learning so that other people can, you know, can benefit from that. And that's very much what Q tries to do as well. So how do you work in that space where there are so many different tools and methodologies? You've got organizations using different, within a healthcare system, who are using different improvement methodologies as well. So how do you work in that kind of slightly, almost kind of like busy QI mindset, like cloud of tools, and trying to kind of, I guess, embrace the sort of the variety, but also trying to hone down a methodology that works for that local system. I don't know, Jonathan or Steve, if you have any kind of thoughts, and if you've come across other organizations that, I guess, have different improvement methodologies and how you work with them.
I think it's again, it's about how you engage and just being able to start having that kind of dialogue when you're coming together and understanding that it's around values and beliefs, and you can really connect with people as soon as they're coming from an improvement kind of way of thinking and a way of background which is open, which is a growth kind of mindset. I think sometimes my experience is we're tricked sometimes by people saying, right, tell me what improvement methodology you're sticking to, because it sometimes comes from you know, wanting to test maybe the confidence that you have, or that other people haven't got an awareness or a confidence in this way of working, which is very much around design and innovation. Design and innovations very much thrown about currently in healthcare, but it follows, you know, a design process, an innovation process is a very disciplined process. It's actually quite a difficult process to actually do. It takes hard work. And so often people say to me, it's not just about the methodology, but can you prove that this has worked? Can you prove that this has happened? I want to see a model project. And as soon as you say, well, this is a project, this is published work, oh, well, that wouldn't happen in our area. You're dealing with a fixed mindset. So how do you engage those people that with a fixed mindset about their role and responsibility and what is their kind of assumptions or what they're seeing, to be able to engage them in a far more open dialogue? that's your first kind of barrier that you're faced with in an interpersonal setting. And so how do you then gently coach, gently lead that person, because we need to work with people. And so I find it quite easy when you're talking to people coming in from a different schooled kind of improvement methodology. The principles and practices are still the same. And if you're versatile in the tools, you can see where they're at and where you can actually work with them in this. And as again, we're in this area of all teach, all learn. So what are their experiences? What are their challenges and things? And what can you learn from them and reciprocate as well? If we can break down them barriers with actually good engagement and good working where we value other people and are able to learn, that's the important factor that we need to embrace.
And I think as well, you know, as Jonathan said, there's been a lot of emphasis on tools and techniques. And personally, I think there's been less emphasis placed on the personal skills that you need to be an improver. So, you know, Bill Lucas's paper on the habits of an improver, I think is a fantastic reference of the kind of things that you're talking about, the flexibility of thinking, the ability to be reflective, ability to form good relationships. And when we're talking about building improvement across systems, you know, I can't agree any more with Jonathan around the role of empathy, putting yourself in other people's shoes to see what improvement looks like at the other side of the fence or the other side of the boundary. Personally, I think, you know, we should be thinking a little bit more about what are these personal qualities, how do we encourage them in people, and how do we create psychologically safe organisations where it's okay to take a few risks with some of the personal qualities and experiment a bit to learn how you can grow yourself.
Yeah.
Thanks as well, Tony, for sharing the resource. It's available on the Health Foundation website, and we'll also share it with the notes after of all the other resources that have been mentioned today, and the webinar link as well on the Q site. Got another question, which is, do you have any evidence or anecdotes that when an organisation embraces QI, that staff are actually happier?
I've got some anecdotes. Did you say anecdotal or did you say hard evidence?
It says evidence or anecdotes. I don't know.
Oh, okay, well, it's given me the choice. So, what I can say is, I was at a meeting the other day, and there was some lovely feedback. Is that engaging in the tools and the methodologies and the sort of the project work. When those people go home, there's still bed problems. There's still staffing issues, there's still buildings that aren't very good, there's still hot desking. But the feedback is that people feel really, their enjoying work has increased and they feel like they feel connected to what they're doing. And that's anecdotal, but that's been consistent through where people have engaged in the right way. Because as we know, when you use the tools, they're all designed to engage, and they do that job so wonderfully well. So is that
Right. I mean, up in Northumbria, we've been measuring patient experience for many, many years under the leadership of Annie Laverty, and we've got incredible kind of data around that. And we know, don't we, from the kind of evidence that patient safety and experience is highly correlated with staff experience and welfare. We know that this is an issue that we should be kind of taking really seriously. So we've just been starting a journey in Northumbria as well to start to measure staff experience and then try and triangulate it with patient experience so that we've got a really robust data around this. We're in early days. We've only been doing it this year, but in September, for instance, I mean, we're a trust of approximately 9,000 to 10,000 staff, and in September we had somewhere between 3,000 and 4,000 members of staff tell us how they felt. So we're getting large data sets that we're starting to look at. So my answer to you, Tony, is I don't know yet, but hopefully watch this space. And maybe next year we'll have some really exciting news to share with you about that journey that we're on.
I mean, for me, Michael West's work around leadership, there's a whole load of evidence there. And so what we're looking at locally, we've developed a 10 questionnaire on joy in work where we can get a score. And so we're looking at going into a team and asking that team to complete the questionnaire so we can get a team score. And then if we can do some intervention work around some tools, especially about what stops making every day a good day, and working on people's frustration and also what they want to do to enjoy themselves more at work. And this is about having more ownership and drive. If we can do an intervention, can we follow that up with another questionnaire? And what we're doing is we've got the questionnaire then becomes an intervention in itself. As soon as you ask somebody how happy they are at work, they're just happy because you've asked that question.
Yeah, definitely.
So something we can capitalize on and develop. As we know, these tools, I firmly believe these tools are good to work with if you're able to have the engagement and the camaraderie, and you're able to build that within your teams. They're engagement tools. That's what fundamentally they are.
Yeah, and there's another interesting one to look at as well, which is led by Dr. Anne Frampton from UHB in Bristol. He's developed an app that was an improvement idea in itself. She wanted to measure how people were feeling real time, and she's developed with the support of the trust, she's developed an app. And if you listen to Robert Woolley, he's the chief exec of that trust, talking about the impact of that, he believes it really helped that trust move to outstanding. And they used it almost as a kind of thermometer to see people were feeling stressed and what they could do with it. So that's a really great example of someone starting with an improvement project, thinking about happiness, and kind of linking it back in a lovely cycle, because now some of their improvement projects at UHB are because they've found out that people were unhappy.
Can I just say as well that the joy in work and the compassion can often be dismissed as quite soft and woolly.
Yeah, pink and fluffy.
Bit flaky, you know. But Michael West describes fierce compassion. And actually, I think organisations and leaders that take it on, it takes quite a lot of bravery. Because it's not just about yourself, it's about the context you're in, and it goes back to what you said about it helps organisations to move forward, but you need to do actions. That's the thing.
You do. And you know, Michael West's work shows that for an average size hospital, this pink and fluffy stuff, the effective team working, it equates to saving about 40 lives a year if you get it right. So this is about this is a mortality issue, not just a well-being issue. So yeah, let's embrace the fact that the pink and fluffy stuff is not pink and fluffy. It really matters, and it's central to improvement.
We've also found out our first wave project work as actually the first things that people look at is how well they're working as a team, and they've improved their performance straight away. So there is evidence locally. If you start using the tools, you will find the evidence yourselves.
Great. I'm gonna have to call it there. We've run out of time, and we could just literally go on and on and on. We've got a couple questions here from Tim still. I'm gonna suggest that we continue this conversation on the there's the comment functions on the event page as well. So what I'll do is I'll post these comments, and then I encourage you all to connect through the community, and you'll have the ability to find each other on the directory and sort of message each other as well. We'll have the recording up on the event page, and we'll also I've also taken down a lot of notes around some of the link resources that we've all kind of discussed. I'll post that on the website as well, and we'll share that with everyone. Thank you all so much for participating. It's been really
Thank you. Really enjoyed that. Thank you.
Great, and enjoy the rest of your week.
Yes, thank you. Bye.
Take care.